Today we're going to talk about advocacy in maternal health, whether advocating for yourself, through your partner, through your community, or hired advocates such as Doula services, which have been found to have a positive impact on maternal health outcomes. Please enjoy this very informative panel discussion.
So I have the honor of moderating a panel with three phenomenal women. The first is Dr. Taska Moore. She's an OBGYN. Dr. Taska. The second person on our panel is Michelle Sanders, and she's a doula, and she's here to help provide education about the Motherhood experience. Last but not least is LaToya Dennis, who is not only my best friend, but she's also the motivated mom. And what I want to tell you about LaToya Dennis is she has dedicated her whole career to helping moms through her Motivated Mom platform, through the work she's doing with the Moms Tour as a fiscal sponsor. She's just a dynamic woman. I met LaToya. I'm a former corporate executive. She called me one day to sponsor a TD Jakes event. And my husband had just had a heart attack. And instead of her doing the pitch about money, she prayed for me and my husband, and we just became fast friends, and we developed a relationship. And I'm proud to say I knew her before she became a motivated mom. So please join me in welcoming the panel. Ladies, please have a seat. Actually, you know what? I'll stand since I'm here at the mic anyway. So I'm going to start with LaToya because she has a lived experience that I think everyone should hear and understand her story. So LaToya, if you could share your lived experience, that would be great.
Yes, I certainly will. Thank y'all so much for being here, and we are glad to serve, honestly. So when we first got invited to host the Moms Tour, I really felt inadequate. I felt like there should be somebody like Crystal or Mozell or our doula or someone else who had maternal health experience, because I just didn't realize that I was a lived experience. My husband and I, we had 5 miscarriages before we were able to have our baby. And my doctor kept saying, Black women have miscarriages all the time, try again. Try again. And so we kept trying again. And hindsight, I probably should have felt like, wait, something's really wrong. But in the moment, and this is why this panel is so important, in that moment, I didn't know how to advocate for myself. I really didn't. I really thought something was wrong with me. I just wanted to have a baby. And so try again and try again. That 5th miscarriage nearly cost me my life. And we decided that we weren't going to have a baby. And a friend of mine said, LaToya, you should go see this doctor. She specializes in high-risk pregnancy. And while she didn't look like me, she cared. She called my former doctor and said, did you happen to do an autopsy on the fetus to determine why she was miscarrying? And the doctor said, no, most Black women miscarry all the time. And she said, but there's a reason. That's called implicit bias, y'all. And that's one of the things that we are combating with this tour is implicit bias. I'll get to that later. But anyway, she ended up doing this test to determine that when you're pregnant, that first trimester, y'all know y'all real tired. I wasn't, because my body wasn't producing progesterone. And the baby needs the progesterone to live. And we got pregnant. She gave me a progesterone pill. Oh my gosh, the best sleep ever, y'all. I'm talking about I take it at the kitchen counter, walk up the stairs, like bam, as soon as I'm serious, it was some good sleep. But the progesterone saved our baby's life, and I had no idea that I was a lived experience, and now I have the opportunity to host this tour and share why it's important for us to understand how to advocate for ourselves, because probably having a doula, you would have advised me early on some things that needed to be checked out because they know and we don't. So this panel, to me, is the most important part of this tour because it gives you the opportunity to know how to advocate for yourselves and how to look for solutions around the morbidities that you may be experiencing.
So I just want to give Dr. Moore kudos because she was not feeling well today. And she came in spite of not feeling well once she knew that she didn't have COVID. And her words to me were, this was too important for me not to be here. So I want her to explain to us why this is so important to you.
Thank you, first of all, for having me. This is important because it's a crisis, and we need to address it as a crisis. And when there's a crisis, it's all hands on deck. We should be all in emergent mode. Whether you're under the weather or not, being able to get out there like a soldier and do what you need to do. It's important to me because I'm a Black woman and I am not excluded from those statistics, right? So we as Black women, whether we are more formally educated, whether we have different types of insurances, whether we live in certain areas, the statistics include all of us. So there's not a single Black woman that's excluded from the maternal mortality statistics. So the underlying issue we know is racism, and as was alluded to already, implicit biases. And implicit bias sort of infiltrates our system and our healthcare system in a number of ways. And when we say all hands on deck, we truly mean all hands on deck. And that means anyone from the representatives in Congress to pass the Omnibus Act to physicians being retrained and reconditioned so that we look at Black women and women of color differently than how we were trained. Because saying that, oh, that's because you're Black is not enough. Having representation and research is important. Part of why we don't know how to care for women of color is simply because there's insufficient research to understand us. And we know also that we're hesitant to participate in research because of the history in this country when it comes to people of color and participation in research. So it's a little bit of a dilemma. And then also having representation in the households, making sure that our communities come together. I was so excited when the pandemic was done so I can get my dads back in the office with my women because it's really important for dads to be equally involved and equally participating in a woman's pregnancy, because I look at it as their pregnancy. It's you and your partner. And the reason why is that dads can be an advocate as well, can look out for warning signs. The Hear Her campaign by the CDC is emphasizing really notifying the entire community what are warning signs so that we're all informed about what to look for, because sometimes the mom may not be able to communicate at the time, but if she has someone in the family or another advocate that can support her, then that could truly save her life. How hard is it to be eating healthy and living healthy when you have to cook differently for the rest of the household because everyone else is eating kind of regular? That's really, really hard. So it's really important that dads are exercising with moms. So when I say, oh, the requirement for exercise with pregnancy is 150 minutes per week, that it's not just her going out on her own, but dads are involved in exercising together. So when I say, this is the amount of servings of vegetables per day, the dads are like, give me my fried chicken, you have your food, that they're in this together. So that's why it's really important to have events like this, to really get the information out there so we all know what to look for, how to advocate for each other and for ourselves.
Great, thank you so much. So I had my youngest child almost 24 years ago, and I had never heard of a doula until I started working on this tour. And so Michelle, tell us about your path to becoming a doula, why it's so important, and your work as a doula.
Okay, so I will start with my path to becoming a doula. So I basically tell people I was born this way. This is something that I've always done. The first baby that I caught, doulas don't typically catch babies, but I did because we didn't make it to the hospital, but he just turned 25. So that was 25 years ago that I caught a baby in the car. We were on our way to the hospital, but I was her doula. And basically what I do is I am an advocate for my clients. I am an educator first and foremost, right? And so I'm the person who has the information, has the answers to the questions that sometimes your doctor may not have time to answer. And I let my clients know all the time, it's not any fault of your provider that they don't have time to spend 2 hours with you per visit. That's just the world we live in, right? But your doula has time to do a deep dive, to give you the answers to the questions that you may have, so then you can truly make an informed decision about your care, right? So a lot of times people are saying that they are giving informed consent, but what they're giving is consent. They don't have the information. They are just making a decision based off of whatever the medical provider has presented to them. And so your doula is a person who can educate and advocate and also provide physical support as well. And just to back up a little bit, so my very first career, I was a hairstylist. I didn't want to do anything medically related. My mother, who was a midwife assistant, she wanted me to be a nurse. Fast forward, I'm an entrepreneur, but I did get into healthcare. So I'm also a certified surgical technologist. I worked in labor and delivery. And then I actually was a doula on the side for many years, because doulas are undervalued, right? So a lot of people think that doulas don't really make good money. So, you know, I didn't want to just step over here just to be a doula, but I wanted to make sure that I could show up for, you know, folks in my community, for my friends, my family, for folks who look like me. And so, you know, I did my doula business on the side until 2017. I transitioned out of the operating room, and I'm a full-fledged doula. 2019, some of you may have heard of the AIM Doula program here in Los Angeles County. So I am the lady who built that program. So the AIM Doula program, it was a program for Black women by Black women. We served 360 families in our first year. So I had 14 Black doulas, and anybody in Los Angeles County who's Black can get a free doula. So we wanted to make sure that finances were not a barrier to people getting support. And so because we know that Black infant and maternal mortality does not discriminate based on education, based on your income level, right? So therefore, it was important to me to make sure that this program was accessible to anybody. It wasn't based on income. And then another thing that I want to touch on again is the systemic racism, right? So this is not about choices, as was mentioned earlier, choices that we make as pregnant women that affect our outcomes down the line, because you're not making a choice to be discriminated against when you go into a healthcare facility. So this is an external thing. It's not necessarily our problem to fix. However, it is for us to make sure it stays in the forefront so we can get this work done to make sure that everybody's safe. Because if we make birth safe for Black women, then it'll be safe for everybody else, right? So we are the ones who, so our mortality rates are 4 times higher than our white counterparts. Black babies are more likely to die before their first birthday than white babies. And it's not because we don't eat well, it's not because we don't take care of ourselves, it's not because we're not educated, it is because of systemic racism. And so to me, being a doula, it is important to make sure I can, yes, give that information, but also help people deal with the fear and the anxiety, right, of what they may be facing. Because it's not all gloom and doom. But we want to make sure that you're prepared, number one, and that you're supported when you go into these facilities. And so that's why I do what I do.
Awesome, thank you, Michelle. So just by show of hands, how many people in the room are working with a doula or have worked with a doula? Okay, we want to bring that number up. So if you are a man or a woman who is interested in becoming a certified doula, please sign up at the table over there. So LaToya, I want to go back to the importance and the role of the dad. I want you to talk a little bit about how your husband, what role he played in helping you bring Chance into the world.
Yeah, so guys, what they say about access to fathers. I mean, my husband, if make sure that you are taking your spouse or significant other in the room with you to advocate, to help you advocate. Because again, in the moment, we don't always know. She alluded to that as well. Having a doula would have made a difference, but so we were able to get pregnant and hold on to our baby. 3 months in, I started having complications, and we go to the hospital. And the hospital, all types of sonograms, tells us that we lost our baby at 3 months. And they said, you need to just go back to the doctor, and your OB is going to give you a DNC. Well, this would have been our 6th DNC in 2 years. And so my husband said, we don't want to do a DNC. Do we have to do a DNC? Perhaps the DNC is causing her to have more complications in her body. And the doctor said, well, if her sac is intact, we have to do it because that could kill her. But if it's not, then, she'll release it and she'll be fine. So my husband said, well, we need to know if she has to do a DNC. My doctor does a sonogram to find that the hospital made a mistake. And had we gone over there to do the DNC, we would have aborted our baby, because there our babies was, kicking and moving. Our son was alive and well, and my husband being in the room advocating for me at a time where I would have said, okay, let's go and do the DNC. And so it's really important to make sure that you bring your spouse or significant other, because ladies, sometimes in the moment we're just not thinking about ways in which we can advocate on what's best for us. And so I always say, I'm 14 years postpartum now because my husband was in the room.
So I think that was important, which is why I wanted her to share that story, because Dad, you play a significant role in the maternal health care journey. So thank you for that, LaToya, for sharing that. So I have one last question, and I'll start with Dr. Moore. What can women do to advocate for themselves, and what role do we have as a community to educate ourselves more about the issues around maternal health care?
There are, usually when we think about maternal health care, we start thinking about from the start of pregnancy. I actually like to think about maternal health care before pregnancy. Thinking about a mom's fertility, being empowered and being intentional about fertility is really important. We know that unplanned pregnancies have a worse outcome compared to planned pregnancies. It's really important for women to be able to have information about your fertility. What are your plans? How many kids do you plan to have? And how soon do you plan to start your pregnancies? How much are you going to space them? These are conversations that should be had in the office as well. And then once you have a plan for your pregnancy, making sure that your actions are tended towards that. And then living a healthy lifestyle, we know, helps with maternal outcome across the board, across all races. So we know that eating well, exercising well. And then sometimes we forget about the mental health portion. So we know that the latest statistic says that for Black women, the primary cause of pregnancy-related deaths is cardiac, right? And then second to that, for our Latino women and for our non-Hispanic white women, it's mental health. So it may surprise you that suicide is actually a top cause of death for women. But it's one of the issues that we oftentimes overlook. So making sure also that your mental health is doing well before entering into pregnancy. Taking care, making sure you have advocates. So we have some single moms, you may not have a partner. Finding someone else that you trust to be in your pregnancy journey with you is also really important. And then during pregnancy, planning for your visits. So oftentimes you'll see that, I know there's a social media thing that goes around with women like showing what their third trimester visits are like hello, good to see you, baby's moving great, thanks, bye. If you have questions, stop the doctor and ask your questions. It is your right. It is also your right to choose your clinician. So it's important to research your clinician. Don't put your pregnancy and your life child in the hands of someone you don't really trust or feel comfortable with. So it's really important. There are apps out there, there are many resources out there now that you can look up physicians, find a Black doctor, and sometimes it may not be a Black doctor, as LaToya said, right? It's just someone who at least can be compassionate and really care for you. Medicine is more than just the scientific portion of it. It's an industry of caring, and you should be feeling that you're cared for. So looking up your physician or your clinician, whether it's a midwife, also is really important. Knowing what your resources are, there are plenty of organizations now that are growing, grassroots organizations that are doing the hard work like today's events, and are sources of information, so tapping into that. And then throughout your pregnancy journey, finding out also, I always say to our community, we don't really talk much about our health. When it comes to Thanksgiving, we talk about everything, how you're doing in school, how's your job going. We need to add health to that, because one of the challenges is when a mom comes and she doesn't know her history, her family history. And sometimes some of those things are unavoidable because there's some estrangement, but definitely finding out, what did your mom have? When did your aunt have breast cancer? How old was she? These are things that are really, really important in assessing and protecting your health. And then asking your clinician, am I at risk for anything in particular? So we know hypertensive disease and disorders are more common in women of color, specifically Black women. We also know that Latino women are more likely not to survive hypertensive diseases. So it's really important that we know, what can I do to control my blood pressure? There are remote programs where we remotely monitor, in my office, we remotely monitor patients at home who are high risk. So there are lots of resources out there. And then in the postpartum period, we tend to ignore the postpartum period. It doesn't get as much attention, but the truth of the matter is that the stats show that 53% of complications and deaths actually happen in the postpartum period. So definitely adding resource, definitely making sure a mom can make it to her postpartum visits, and that she has the community to support her to do so. Sometimes it's really hard if you have a toddler and now you have a newborn to really get to that visit. And if you can't physically get there, finding out what are my resources. So for some of our women, we make sure that the insurance pay for their transportation if transportation is a social barrier. We make sure, and so for me, one of the evolvement of my career is asking the why question. So when a patient doesn't show up, just don't assume, oh, she just doesn't care about her pregnancy. It's extremely rare to find a woman who doesn't care about her pregnancy. There's always a reason to the why, and the why is almost always a social determinant, which is caused by racial issues of racism in this country. So providing transportation. If she doesn't have childcare, looking at nonprofits that provide childcare, they're out there. And we work together with all these different organizations to really attack these social determinants. And then knowing what the warning signs are in the postpartum period. Very high time for infection, excessive bleeding, blood clots, but also mental health issues. And we routinely screen for depression and anxiety symptoms. And also don't ignore the dads in this area too, because we know the more likely moms have perinatal depression, anxiety, also dads can experience the same thing as well. So making sure that everyone's assessed routinely. And if you can't get the assessment, then there are online screening tools. I always tell people, do your screening tool online and then hand it to your clinician and say, what do we do about this? You know, definitely making sure you know what's common, what you're specifically individually more likely to encounter, and then doing the things that we need to make sure that we counter those issues. And then knowing that we're looking at a whole year later. It's not just 30 minutes, it's an entire year later.
Thank you. So that was a lot of information. So Michelle, I have the same question for you. From your perspective, what can moms do to better advocate for themselves, and then what role does the community have in supporting moms on this journey?
So, you know, like Dr. Moore said, this is like a family issue, right? So like, yes, mom is pregnant, but even like whoever's in the home, whoever is close to you needs to be there, right? So you need another set of eyes, right? If you have other children, you need another set of hands, right? But also just understanding, like, us as Black and brown people, you know, our history in this country. And so we sometimes are struggling, but will not ask for help. We are sometimes watching each other struggle and will not help, right? And so I tell my clients all the time that pregnancy and motherhood does not equal suffering, right? So that means that as a pregnant woman or a postpartum mom, yes, it can be hard, but your family should be helping you. Your village needs to be there. If you don't have a village, then we help you build that village, right? Because it is very, very important to make sure that the support is there so that breastfeeding can happen if we want to breastfeed, so we can, do that as long as we want. And then the mental health piece. It is very important, like pregnancy, being a new mom, it can be very isolating, right? If nobody is checking on you, you could be going on a downhill spiral and nobody knows, because it's just like, oh, it's hard. It's supposed to be hard. When honestly, it's not, right? And so that's one of the things that my organization does, is we make sure we fill in the gaps. So I just recently had a client who could not get to her postpartum visit. So we made sure that she got to her postpartum visit. Being transparent helped me know what she needed, right? So it's like, put the pride aside and ask for the help that you need. Sometimes people will not help, but there are plenty of people that will help, right? So then I find out that she doesn't have food in the refrigerator, and we put food in the house. And the thing is, there's not a question that comes from me to them as to why we're in this situation, because it's really not my business, right? The reason that this ministry was started, this nonprofit that I have, is to be able to grab money from large organizations that have money and give it to the people that need it. And so there's plenty of money out there. Like I mentioned, the Doula program, it's free. So I think my budget was $1.5 million a year. That's for doula support for Black women only. And at one point, we were at the point where people weren't coming, and that's because they didn't understand what a doula was, right? And so they thought that a doula was for home birth. And so once we got the word out what doulas actually do and the type of support that your doula can offer you, then we saw that people are coming to the program and they're getting doulas. So we do support home births, but we also support birth center births. We also support hospital births. So you don't have to have your baby at home unmedicated and have a doula. You can have a doula wherever you choose to go. And just to put it into perspective, you as a pregnant woman, you have a baby once every so often, right? Me as a doula, I might see, 3, 5, even 10 births in a month, right? So I have experience and I know what's supposed to be happening there. So having somebody who understands this environment, it really helps, because you as a pregnant woman, as the person in labor, you're not supposed to be fighting. You're not supposed to be arguing with nurses. You're not supposed to be trying to watch the doctor and all of that. Your partner can do that, your doula can do that, but you as the woman, you need to be focused on your body, your baby, and making sure that you do the job that's in front of you, which is birthing that baby. And so your folks around you are supposed to make sure that that is safe for you to do that.
Thank you. So I see Crystal has joined our panel, so I'm going to ask you to close us out.
Okay. Yes, you guys, and I want to reiterate what Michelle said, because it was one thing that I definitely believe in, and it's advocacy. And you heard me say earlier that I too am a full circle doula and a lactation consultant, not working actively now because I'm at the church. But what I wanted you guys to walk away with is that you need an advocate, and the advocate cannot be you. The advocate needs to be someone who is coming alongside you, who is advocating for you. So your birth plan, they should know what that is, whoever that advocate is. It could be your doula, it could be your spouse, it could be your mother, your grandfather, your grandmother, your best friend. It doesn't matter, but you need someone there to advocate for you. Anybody who's been through birth knows that it's very difficult to concentrate on too much anything when those contractions start coming, right? The concentration is on, let me get through this. So I want to encourage everybody to ensure that they have an advocate and have someone who's been there before, who's done it before, who understands, because we don't want the advocate who passes out in the labor and delivery room. I've seen it happen, and I'm sure you have too. So it needs to be someone who is experienced in this. And like I said, it can be anyone, but it needs to be someone who knows what it is to birth a baby and not be scared of the process. So I just wanted you guys to walk away with, you need an advocate, and that advocate does not need to be you. And one other point that is coming to me: never allow someone to tell you what you can't do without pushback if that's not what you want. Never allow someone to tell you what you cannot do without pushback. You need to have a clear understanding of what it is that they're doing to you, why you have to do whatever it is, why it's happening, what it involves. There are too many instances, particularly here in Los Angeles County, and statistics will show where women of color have been given advice that was not what it was that they wanted. And it's across the board. So, and that's not to scare you. What I want you to do is go in and feel empowered to be able to say that, no, this is not what I want. This is not what I asked for. Why is this happening? Now, I'm not saying that inherently it has to happen or that it does not have to happen, but have a clear understanding as to why it's going on and what's happening. So I want to thank everybody for being an attentive ear and listening. And I'd like to know that somebody walked away with something. So can I get somebody to raise their hand and tell me something that you walked away with that you're going to implement, use, or that you did not know before this panel? Sure.
I didn't know that doulas weren't only for home births.
I know.
Awesome. Yes, we want to know that you walked away with something. That's a great one. That doulas are not just for home birth. Anyone else have something that they walked away with that they can do? Yes, Kristen.
Make sure you bring your spouse to advocate for you in the delivery room.
Amen.
Period.
Exactly. Or that significant other, right? Yes.
I'm so sorry, I came in a little late. So what is exactly a doulas?
Okay, so first and foremost, a doula is not the same as a midwife, right? So some people use those terms interchangeable. I am not a midwife, right? So midwives are medical providers. So some people go to an OB like Dr. Moore, some people go to a midwife. And so as a doula, primarily I'm an educator, right? And so when it comes to the questions that you may have, following your doctor's visit or just anything that's going on with you, your doula should be a resource for you to be able to answer all those questions, or if they don't know the answer, they know where to get the answer. Evidence-based information, right? Not my opinion. This is not about what I would have done when I was in this situation. This is evidence-based information that your doula is supposed to present to you, right? Your doula is also emotional support. So, you know, our hormones, like emotionally, all types of stuff is going on when you're pregnant. And so your doula can be like that sounding board and that person who you trust to talk to. And then also the physical support, right? So everybody doesn't want to just go with epidurals or pain meds. Sometimes people want a natural, unmedicated labor. And so your doula can help you identify ways that you can better manage the discomfort of childbirth.
Anybody else have questions? All right, well, join me in giving these ladies a hand. And I'm going to ask.
Thanks to the Mom's Tour for making us a part of this transformative panel discussion. This is Dr. T signing out for Healthy Bump Club here on YouTube and healthybump.club on Instagram. We hope to see you guys next episode, and don't forget to advocate for your health.